All right. Good evening, guys. Um, it's about 8:15 and almost my bedtime. But I wanted to get this video done, and hopefully it won't be so long and it won't be so hard to put on Moodle for me. This is your first video with a flipped classroom. Okay, so in order to know what a flipped classroom is, let's take a look and see what a traditional classroom is. Excuse me, a traditional classroom. You go into class, a teacher lectures, teacher assigns homework, and you do your homework at home. You come to school, and it's a repetitive process. You guys know that I do a blended learning. I do a mix of face-to-face. And now we're going to start implementing videos like this, and we do Moodle, where it's a place where you can hand in your homework and see lectures and things like that. So it's a blended type of learning. I like the flip video. Studies have shown that flipping your classroom does wonders for students. Number one, you can watch me anytime you want to watch me. Not lecturing in school. So your homework is going to be watching videos. Not all the time, just some of the times I'm introducing it to you. You're going to be watching some videos, taking some notes. I may have a handout for you to fill out, like a KWL or maybe a Venn diagram of some sort on certain days. And then you come into school and we do an activity, we do a discussion, maybe we'll have a formative assessment to kind of reinforce the concepts of what I want you to learn in the video. Okay? And then life goes on as normal. So today you have a video. Today's a great day for me to do this with you because we have Mrs. Noble here and I'm gone. But it's like I'm here because I'm talking to you. All right. So let's get started. I can get rid of this and I can pull this up. I can say, Kyle, warn me when we hit slide 69. Okay. We're going to start with slide 53. Observing standard precautions. We just finished, I think, up washing hands yesterday. So observing standard precautions. Blood and body fluids are the main ways pathogens are spread. We talked about that. We talked about that in the very beginning, probably on slide 10. The major pathogens that we worry about is hepatitis B, hepatitis C, and HIV. And extreme care has to be taken when there is an area or an object or a person that's contaminated with blood or body fluids. You don't want to get hepatitis B or hepatitis C or HIV. So you have to take extreme caution. And that's when in 1991, OSHA, and you guys should know what OSHA is because we already discussed OSHA, established the blood-borne pathogen standards. Okay, blood-borne pathogens, BBP. Okay, blood-borne pathogen standards need to be followed by all healthcare workers. Okay, if you work in a hospital or you work in an area and they don't implement and follow the blood-borne pathogens, then there could be penalties for it. Okay. So, what is blood-borne pathogens? Okay, what is the standards? Well, you need a written exposure control plan, and you need to update it annually to minimize or semi-eliminate employee exposure. Okay, so what are you going to do to control? Oh, I can't even think right now. Sometimes it's too late for me. We'll come back to that. Identify all employees with occupational exposures. So that's when you have to write up incident reports. I talked to you one time about how I got poked with a needle and I had to do an incident report. Okay. Blood or any other potentially infectious material like semen, vaginal secretions, or any other body fluid. Okay. If you've been exposed, then you need to be identified. Hospitals, anywhere where you work, if you're going to be exposed to body fluids, then they have to provide the hepatitis B vaccine for free. Okay? And of course, they have to provide to you your personal protective equipment. Okay? Personal protective equipment is gloves, gowns, masks, face shields, lab coats. Okay? A facility that you work in has to provide adequate hand washing, okay, and supplies. They have to ensure that the work site is clean and in a sanitary condition. Well, why would you work there if there's not? But they have to maintain a clean and sanitary condition. And they have to follow measures for immediate decontamination of surfaces when they're contaminated. I could tell you a story about, and I might have told you this already, when my parents bought a hotel up in the UP, and the owner was showing my mom how to clean a toilet and the stuff that they use, and she squirted on the toilet and then she immediately wiped it off. And my mom was like, well, let me read the directions after the lady had left. And you were supposed to leave it on the toilet. I think I told you guys this story. You were supposed to leave it on the toilet for X amount of time. I can't remember. Anywhere, I think, from 3 to 6 minutes is what I think it was supposed to be. And the lady put it on and she wiped it off. So she wasn't following decontamination procedures. There's no way it could have been disinfected that way. So never sit on a toilet. I know you're all laughing right now. You're supposed to dispose of infectious waste correctly. You're supposed to enforce rules of limited activities in any potentially contaminated area. Okay. You want to provide appropriate containers for contaminated sharps and other contaminated items. So we have biohazard bags, and they're red, and you put stuff in it. You would never put a sharp, like a needle. You would never put a sharp in there. Sharps go in a sharps container. And if I was there, I'd show you what a sharps container looks like to dispose needles, because we have one in the room back by the bed. So you would put stuff where it's supposed to be appropriately. You'd be crazy not to. You post signs at the entrance to work areas with occupational exposure and biohazard materials. There's red biohazard labels, and I told you the bags are red, and I think I have one in the room. I'll show it to you when I come in on Thursday. You're supposed to provide a confidential medical evaluation and follow-up for any employee with an exposure incident. So it's confidential. So when I got poked by the needle, I went and I had my blood drawn, and I had to go down to employee health, and it was all confidential. It's supposed to be confidential. It was all confidential. And have my evaluation, my shots, and then follow up there. And then your employers are supposed to provide training. The Needle Stick Safety Act. Which group has Needle Stick Safety Act? Say that 10 times fast. Was passed in Congress in 2000. The Centers for Disease Control and Prevention estimated that between 600,000 and 800,000 needle sticks per year. Okay, I was one of those statistics. OSHA revised the bloodborne pathogen standard requirements of this act. Okay, they're supposed to identify and use effective and safer medical devices. Today we have needles that have safety, that has a safety thing on it. So when you're done, you can push it and then it covers the needle. So there's no recapping. Back in the olden days when I started nursing, there wasn't such a thing. And it was okay to recap. It's no longer okay to recap. We don't ever, 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 ever recap a needle. Okay? With this Needle Safety Act, you're supposed to incorporate changes in an annual update of the exposure control plan. So you're supposed to update it annually. Okay? And then they're supposed to solicit input from people like you and me who do direct patient care. They don't want it from just managers making the decision. They want the people who are actually using these needles to get input from them, which makes sense. Okay? Your employer is supposed to maintain a Sharps injury log, so when you, if you do accidentally get poked, it goes in the log. And you are to make sure that every employee uses standard precautions at all times. All times. So what are standard precautions? These are rules that the CDC put into place. They developed. You need to treat every body fluid as if it's a potential source of infection. Vaginal fluid, feces, urine, sputum, blood. I can't think of anything. A wound from that's oozing stuff. You're supposed to treat everybody as if every body fluid is a potential source of infection. Okay? All patients need to be considered potential sources of infection. I've talked about this before. So, in any situation, here's situations that you're going to use standard precautions. When you come in contact with blood or any fluid that contains blood. Body fluids, secretions and excretions, mucous membranes, non-intact skin, tissue or cell specimens. Okay? And apparently on page 365, there's a great source for you to look at and be familiar with. Okay? You're not going to touch any of these without gloves. I could have a student in end-stage liver failure that's 40 pounds retaining fluid, an extra 40 pounds of fluid, and they're oozing at their skin. If you were to touch them, they'd be wet because it's weeping. Their skin is weeping. I wouldn't touch them without a pair of gloves on. Okay? Any blood or any fluid, you want to use standard precautions. Gloves are part of standard precautions. They need to be changed after contact with each patient. Something that I told you, was it not Dr. Phil? Who was Dr. Oz? What do you call that? Pharmacist. Pharmacist? The pharmacist didn't change her gloves between Dr. Oz and the pregnant lady, right on national TV. Make sure you change the gloves after each contact. And you know you have to wash your hands with each change of glove. Okay? And you don't want to contaminate your skin when you do that. And when I come back, we're going to practice gloves. Okay? Putting on gloves and taking gloves off. Hands, I told you hands need to be washed, and gloves cannot be reused. That's gross. It's just gross. Kyle, am I near 69 yet? Okay. When to wear gloves. You wear gloves whenever you're going to come into contact with body fluids, secretions, or excretions. When you're handling or cleaning contaminated items or surfaces. Anytime you perform an invasive surgery. Anytime you perform a venipuncture, you're going to poke someone for blood, you're going to wear gloves. Gowns, you wear gowns during procedures that are going to have splashing or spraying. You wear a gown to prevent contaminating clothing or their uniforms. I can remember plenty of times I've taken care of patients and I took my clothes off in the garage and immediately put them in the wash machine with no other clothes from my family to wash them. And not because they were splashed with blood, but it was just a buggy room. I can't explain it, but you'll get there someday. A contaminated gown must be handled per hospital policy, and hands need to be washed immediately after removing a gown. And we're going to remove gowns. You guys are going to remove gowns. You're going to put them on, and we're going to practice. Masks and eye protection is worn during procedures that may cause splashing or spraying. I talked to you that one time a nurse was suctioning a patient, and he hacked up a loogie, and her mouth was even open, and it went into her mouth. So you need to prevent exposing your mucous membranes to pathogens. So you use a mask. So that's all I got to say about that. Protective eyewear and face shields protect the front, bottom, and the sides of your eyes. I used to always like to wear my glasses at work because I always felt that they were really protected, but they weren't really protected at the sides. Okay, if the eye protection and the masks are not disposable. They need to be cleaned and disinfected before reuse. And usually there's a place that does that. You don't have to do it. Okay. And then I believe we're on 69 right now, talking about sharp objects. And I'll stop right here because I think is that next one spills? All right, I'll do sharp objects. Use extreme caution. You don't want to poke yourself. You don't want to cut yourself. You use safe needles or needleless systems. And nowadays, in 2013, I'm pretty sure that's probably all what hospitals have now. You follow policies regarding these needles. You use the sharp containers, and then you follow the laws regarding disposal of sharps and sharp objects and in the sharps containers. And I'll go all over this again when we play. Okay, so I am going to say that I'm done for today. You do have to have note cards. Hand them in today, or you can hand them in the following next day like usual. There's a lot of work to be done. Make sure if you're working on your group project, you're working. I've been getting a lot of I'm not getting a lot of complaints, but Mrs. L is telling me that she's seeing a lot of people that are not on task. And when I'm not there, she has a list and she'll tell me, hey, this person wasn't on task, this person wasn't on task, and I don't question her. I go by her word because I don't play the mom and dad in the middle thing. So you guys stay on task, and I know you will because you guys are a great group of students. And I will see you guys on Thursday. Peace out.